Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
It was just wonderful. It was like seeing the sunshine right after a heavy rainstorm. It's kind of hard to describe, but it just was an overjoyful feeling of, okay, I finally found something that's going to work for me.
Hello, and welcome to Getting Clear on Psoriasis. I'm your host, David Brandt, and I've been living with psoriasis for more than 30 years. In this podcast series, we bring you stories about different people's experiences with psoriasis and hear from medical professionals who treat the condition every day. Our goal is to offer tools and resources to help you manage your psoriasis, seek out the best treatment options, and live a more full and productive life. This podcast is for general information purposes only and should not be substituted for medical advice. Please consult your own medical professional with any questions regarding a medical condition, advice, diagnosis, or treatment. Many of the topics we focused on in this podcast series have dealt with the difficulties of psoriasis, the itches, rashes, and skin flakiness, the cost of medications, the insurance hurdles, and the stigma, shame, and self-isolation that many people experience. Psoriasis is not curable, and some patients will have it for the rest of their lives. But newer medications are making it possible for a number of patients to experience clear skin for the first time in years.
Emotionally, it was like the heaviest weight in the world was lifted from my shoulders.
79-year-old John Latella battled severe psoriasis symptoms, along with the stigma, for years.
You don't know how great it is to be able to wear Bermuda shorts on a hot summer day. I used to go winter and summer with long sleeve shirts and be out in the sun. I couldn't take the long sleeve shirt up because my arms were covered from my knuckles all the way up to my shoulders with psoriasis. To wake up and not have to vacuum the floor every morning because you were so filled with scales. I didn't have staring anymore. I didn't have people looking at me as if I'm different. Internally, emotionally, it lifts you. It makes you feel so much better about yourself, and you can move forward. You don't have to be stagnant.
In John's case, getting on a biologic medication finally did the trick. Vicki Wilkerson of Shreveport, Louisiana, has seen similar results.
I've took pictures to where I could compare those pictures to what I was seeing on my skin so that I could actually see that the medication was working. And once I realized that it really was working, it was just wonderful. It was like seeing the sunshine right after a heavy rainstorm. It's kind of hard to describe, but it just was an overjoyful feeling of, okay, I finally found something that's going to work for me.
Still, experts like dermatologist Dr. Mona Gohara caution that the life-changing results that many patients experience are not necessarily permanent.
I think one of the biggest misconceptions about psoriasis is that it is curable. It's treatable, but it's not curable. This is an inflammatory skin condition that is genetic, and one's immune system is kind of wired to give them psoriasis. We can give them long periods of remission and really change their life, but it's never curable. It's treatable.
And if left untreated, psoriasis can worsen in severity over time. Dr. Gohara also says it's crucial that a treatment plan for psoriasis be just as comprehensive as for many other serious health conditions.
Can you imagine a different scenario where you have a cardiologist and she advises her patient to only partially treat their cholesterol? That would never happen. Or a GI doctor who's advising her patients to only treat their heartburn a little bit. That just wouldn't happen. So if we translate that mentality into the skin as being an organ, it's optimizing your skin's health by treating the psoriasis maximally and recommending to the patient that that is something that is reflective of good skin health.
Other experts, like Dr. Ahmad Shatil Amin, say there are still a lot of factors to consider, even if psoriasis symptoms begin to improve.
Psoriasis may be connected with other diseases like heart disease, stroke, and diabetes. So patients who have psoriasis are a little bit more risk for all these things. So it's really, really important that a patient who has psoriasis, especially a patient who has moderate to severe psoriasis, it's really important that they see their primary doctor once a year to do an annual thorough checkup, to get any appropriate blood work done, because we want to be able to mitigate and check for all these other risk factors.
As people continue to struggle with their psoriasis every day, many wonder if their quality of life can ever get better, ever return to something like it once was. Dermatologist Dr. Joel Gelfand believes the answer is yes.
What I explain to a lot of my patients is that what's very normal for us as humans is to get used to our new normal. And we forget what life was like without psoriasis. And oftentimes we don't realize the accommodations we're making in our life, the clothing choices we make to try and cover our psoriasis, the time we take each day to manage it, the professional and social opportunities we don't avail ourselves of because of this disease. And so we need to be mindful of that and recognize that with the advances we have, for many of our patients, we can do better than they currently are if they're still struggling with their disease.
To wrap up this episode of Getting Clear on Psoriasis, I'll leave the final word to Dr. Mona Gohara.
I want everybody who's listening to this podcast today who may be struggling with psoriasis or who has struggled with psoriasis, realize that science has come so far. And even in the early 2000s to now, psoriasis treatment has drastically changed. There are a tremendous amount of options. There are a tremendous amount of resources. There are a tremendous amount of experts. There is no reason to suffer and struggle with this condition.
If you like what you heard, head over to Apple Podcasts and leave a 5-star rating and write a positive review. It'll help spread the word to more people who might be in need of support. And if you know of someone living with psoriasis, be sure to tell them about this podcast. As always, we welcome your feedback, so send us an email to psoriasis@ghlf.org. I'm David Brandt. Thanks so much for listening. This podcast is made possible with support from Walgreens and Alliance RX Walgreens Prime, sponsors of the Global Healthy Living Foundation.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.